Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello and welcome to Practice Plan's podcast. With me today is Lisa Andrews Davies, who is a dental nurse within the NHS. And we're going to be talking about nurse-led clinics. So before we do though, Lisa, in case people haven't heard your previous podcast, would you just sort of tell us a bit more about yourself, please?
Course, yeah. So yes, my name is Lisa Andrews Davies. I work for the Hertfordshire Special Care Dental Service within the community. So it's an NHS. It's not a practice. It is a community service that is managed by the PCTs. There are these PCT community dental services all over the country in different parts of the area. And we basically treat people with disabilities, medical issues, and also people that have very, very high anxieties for whatever reason. And on top of that, I also sit as the chair and the charity lead for the Society of British Dental Nurses. And they've been very, very welcomed, and the patients are enjoying them, and actually we've found them very beneficial. So your nurses can have additional qualifications in things like oral health, and also CBT, which I've done training in as well. So there's two kind of pathways for this. So what happens now is when a patient is initially referred to us, they are seen by a nurse who does the assessment, talks to them about their oral health, their diet, and just manages them and then triages them. Obviously, if the patient has pain or there's anything obvious, they would get seen straight by a dental officer. We wouldn't hold on to that person.
No.
And it may be that person, often children that we tend to put through the pathway, but often they're very anxious. So then that nurse may do a couple of visits with that child and maybe even do a bit of play-led type sort of acclimatizing, or just keep bringing them in just so they feel familiar with the situation, the area, and just practice things like, oh, we're going to open your mouth for 10 seconds, show them the chairs, just lots of little things that actually could be quite daunting, especially to young children. And it's actually become very useful, and the patients are enjoying it as much as the staff are. It's given the nurses a much wider sort of scope of practice within their professional body, which is great for them as well. So I think it's actually all round. It's a good thing. And I know within private practices and the NHS practices, it may seem a little bit of an unusual idea and a concept, but it could potentially be actually quite valuable asset to each surgery. They could maybe run sort of little oral health sessions after school for children with a dental nurse and have 3 or 4 children in there. And it could be a small fee maybe, or it could just be so we can be promoting oral health. And the other pathway is that I do a lot of CBT based with some of our very anxious patients as well. So they are referred to me. So either they are referred directly from their referral, or occasionally they come to me by the dentist. So they've seen them and just said this patient really could do with some support to get them to that point where they will accept treatment. And it can take several visits sometimes. So this is where it's not as cost effective, but with a nurse it could be potentially more cost effective. So the patient may come and see me, and we can do some acclimatizing. So it could just be frequent visits just to get them used to it. I had one lady recently that was absolutely petrified of dentists. She'd had a bit of a bad experience as a child, and needed some dental care. She wasn't in pain, so we had time to work with her. And literally, I used to meet her outside the first couple of times. Then we kind of gradually moved into the clinic area, and then we moved into the surgery. I eventually got her into the chair after about 4 or 5 visits.
Wow.
And then I got the dentist to look at her, and she's now having her treatment done with just local anaesthetic.
Wow. So how long did that take? Over what period of time?
It was about, so it's every couple of weeks you need to see that person for, because you need to keep the frequency.
Yeah.
And within it's normally 6 to 8 visits that you normally get a good response. I'm not sure why 6 to 8 is the magic number, but it seems to be. And I think
Yeah.
it is just that familiarity, and also she became very trusting in me and believed what I said. If you want us to stop, you tell us to stop. And it's having that one person, I think, to just be there for
Yeah.
you, and feeling comfortable and knowing that they are going to stop, or be there to protect you almost, I guess.
Yeah.
But yeah, and it's done really well. She's at the point now where she's had her treatment, and I've handed her over to another one of our nurses now, who is now also doing similar work that I'm doing within their own clinic. And they're building quite a good rapport, so they've carried on with a few visits. And now this young lady comes in for her checkups. She's had a lot of oral health prevention and diet advice, so she doesn't really need a lot of treatment.
Yeah.
So it's a win-win really for everybody.
Yeah.
There's just so much we as nurses could do to support the dentists, and promote good practice and oral health and diet. And like I said, I did a CBT course, so cognitive behavioural therapy for dental anxiety management.
Oh, right.
And
Specifically for that then. Sorry.
yeah, it was run by King's. I don't think they're still doing it, unfortunately, but I did it with my senior consultant. And we've been running this sort of service between us. And it's just been absolutely astounding the amount of people we've managed to support and get through that would never have managed to get treatment done any other way.
Yeah.
So it's really been a useful tool.
So the consequences of them not having treatment is what? Down the line, sedation?
Pain. Yeah, I mean,
Yeah.
it could be sedation, but I mean, having pain is the worst. Toothache is probably the worst feeling, and most people will tell you that.
Yeah.
And going around with a smile that they're not happy with, because you can see the decay or the broken teeth. So that patient loses confidence, and then they get into this vicious circle, almost think, well, this is how it is, I've got to live with it. But you can actually change their life by just doing this. So with a bit of anxiety management, we have managed to do treatment with sedation for some of them that just wouldn't manage it without. And also I'm working with a gentleman at the moment that needs a general anesthetic, and he's so phobic of going anywhere near anything medical. So we're having to do a very gradual exposure for him. So these sort of things can be done. You can also do a bit of desensitization with these people as well. So you could gradually, so if someone's, say, needle phobic, that, which is very common, as I'm sure.
Yes, it is common, isn't it? Yeah.
So I mean, I'm seeing a lady at the moment, and on the first visit I just put the syringe in front of her. The next visit I put it in front of her, said you just need to touch it. So it's very gradual. So the next time I see her, I'm going to get her to just briefly hold it.
Right.
And it's just bringing them in slowly, and just giving them lots of reassurance and lots of support. But it does need to be quite a regular thing, every couple of weeks.
It's quite an investment in time, isn't it, for someone?
It is, and that's why I guess for general dentists it's just not practical, and patients are probably not willing to pay for that time. So it's something that there needs to be, there needs to be something out there to support these patients, because we've got so many patients that are petrified of dentists.
Yeah.
And I'm sure, I don't know, I'm sure many of the dentists and the nurses that are listening to this today would say the same. As soon as you say you work in the dental profession, they put their hands over my mouth. I hate dentists. That's the first thing people say to you. And they're like, we're nice people, we're okay.
We've got feelings as well.
Yeah, exactly. Yeah. But I think people just have that one person has a bad experience.
Yeah.
And it can have such an impact on your life.
It can, and I mean, I must admit that I've never had a bad experience at the dentist, but when I go to see the hygienist, I absolutely loathe having a scale and polish. It's just uncomfortable, isn't it?
Yeah, it is. And I think it's okay to say it's a bit uncomfortable, but it's okay. And I think that's what we have to be honest as well. And I think that's the key part of it. And I can't lie to people and say, oh, we're not going to do an injection, then we can do one, because you can't. It's an assault. And I always put that to the patient as well.
Yeah.
And just say, I'm sorry, but it might be a little bit uncomfortable, and it's okay. But also there is something that we call the nocebo effect. And this is where we won't say, so when someone's doing an injection, we wouldn't say, oh, it's that's the worst bit over. We'd say, oh, we're halfway through now. So try and use positive.
Yeah.
Because
Yeah.
acknowledge that it's not nice, but just say, we're halfway there. We're nearly done. Okay, we're all done. Finished. Well done. Thank you. Rather than saying, oh, I know it's a bit sore, or ouch, I'm sorry, I'm going to scratch you. You know, we need to make it different.
Yeah.
And this actually does have a very much of a positive impact on the patient as well. Because if you
Yeah.
say negative things, they're going to think it's negative.
Yeah. So referral to you, how does that happen? How will someone get referred to you?
So within our service, the patients are referred via the general dentist into the service.
Right.
They have to fit the criteria in the first place.
Mm.
And then they are managed by the referral team, and then they decide if they're suitable to be referred straight to see the dentist, or if they may need to see me for support to get through it. And no, really always, I always make a phone call to that patient when I first get their referral, just to have a chat with them and
Yeah.
just do some fact finding. And I think that's really important.
Yes.
And just finding a little bit about them. And sometimes it's just silly things like finding out what their love is, like with children, like Pokemon or dinosaurs. And it's just
Yeah.
finding that one little thing that you can talk to them about. And
Yeah.
it's surprising, you kind of get them once they talk to you, once you find that little thing that they love.
Mm.
But I mean, the thing is, I've now had to learn things about Paw Patrol and Pokemon, and so I'm getting quite the authority on all these things.
Yeah.
So I just, and doing a little bit of fact finding, just getting to know your patient is quite
Yeah.
important. And
Yeah.
also, a lot of the parents, if the child's anxious, 9 times out of 10, the parents has anxieties, and they don't realise that they're putting their anxiety on the child. So you're almost having to support the parent as well.
Mm.
Um, but yeah, but we've, like I said, we've had some really good responses and really, really good, like outcomes, and prevented general anaesthetics.
Which is great, isn't it?
Yeah,
It's really
yeah,
good because
yeah,
hospital admissions for children are sky high for dental work, and
yeah,
it's ridiculous and scandalous, isn't it, really?
yeah. I mean, it's been in the news again, I think, this week. They were
Yeah.
talking about it, that the most use of general anaesthetics is for dental extractions in children, which is ridiculous when we are in this sort of modern world and society. This is so preventable. And I think that's what everyone, we're saying, dental decay is a preventable disease. And I
Yeah.
think this is where the nurse-led clinics come into it again, where you can use them to go out, have an army of dental nurses going out giving all the preventative advice. We're very knowledgeable and very practical, and I think if nurses could be used more to do that,
Mm.
and it enhances that nurse's job, and a lot of us really enjoy going out there, sharing our knowledge,
Yeah, but well,
and
you spent long
making a
enough
difference. Yeah,
learning it, haven't you, and acquiring your
yeah,
knowledge as well. Why
yeah,
not spread it more
yeah,
widely? How do
yeah.
you see ways that this could be developed further? Apart from sending armies of nurses out, which
Dental
actually
nurses.
scares me, the idea.
Yeah, I mean, I think we need to. I mean, with the anxiety pathway and the nurse-led clinics, I think we just need to promote them, and just make practices aware that this is something that could be done. I don't know how they would be funded. Obviously, that's something that I think that is the biggest problem, is the
Yeah.
funding. So this is something that probably needs to be spoken at a level within your community,
Mm.
and speak to the ICB and people like that, just go to them and say, look, I've got an idea. Why can't we use dental nurses to do this?
Yeah.
And this is basically what's been happening in Hertfordshire.
Mm.
And we seem to be doing very well. And I know these things are happening in some other sort of counties, but I don't know how wide it's going yet, but it's definitely moving in the right direction. It's just quite slow, I think.
Yeah. Yeah. As
But
ever.
it's like anything new.
Yeah, yes, it's like a bit like pushing a liner sometimes, isn't it? It
Yeah,
starts off
yeah,
very slow and then it gains momentum. So
yeah.
if for practices that don't have an NHS contract, I mean, I suppose they could do something similar themselves, can't they? They can upskill their nurses to be able to do
Yeah,
this kind of thing.
yeah. I mean, there's like the oral health is probably a really good way in for those nurses.
Mm,
And even the oral health nurses, they don't have to necessarily have anxiety management training. They could just be using their oral health to be using for like acclimatizing, getting that person in just
mm,
frequently. And I'm sure if it was sort of set up in the right way, there could be a fee for that nurse. You know, that the practice could charge a small fee, like you go to your hygienist. You know,
yeah.
there could be like a scope for that, I'm sure. And like I say, prevention is so key. And if we could utilize the nurses to do that and
Mm,
do the lot of the nurse-led clinics in that way, I mean, I mean, how much could we prevent? It's
yeah,
just
indeed.
makes you think.
Yeah.
And it in turn help the NHS to ease the general anaesthetic need for dental disease and decay.
I mean,
So
is the Society of British Dental Nurses promoting this kind of nurse-led clinic as well?
oh
Would they?
yes, yeah, we've definitely spoken about it, and we've done some webinars on it, and I'm sure there's another one coming up,
Mm,
because obviously we want to support dental nurses in this area because, again, like I say, it's just so good to have that widening scope of practice for nurses. And we're all, if you've done your oral health training, which is a separate course,
mm,
why not use it?
mm,
It's such a good thing. And they can do things in the practice and make good posters and things like that, which could be for patients to read and getting the information across.
yeah.
Um, and I think just supporting our dental nurses and our members in that way could just open so many doors. And there's so much that dental nurses can do. And I think that's why with the society, we're just like,
Mm.
let's get out there and show what the nurses are capable of.
Indeed. And I've spoken to Fiona Elwood from the Society before now about squiggly careers.
Yes.
And I suppose this is a way of actually stepping off your linear path, isn't it? And
Yeah,
having a bit of a squiggle in your nursing career.
absolutely. Yeah. And then I've certainly taken that sort of squiggly careers pathway. I've sort of changed my pathway considerably. And I love dental nursing. I'm not going to lie. I enjoy my job, but also I like that little scope of something a bit more and actually taking responsibility and making my own clinic and making it run and running it and having my own patient list. I really enjoy that side of things. And I'm
Mm.
sure many dental nurses would if they were given the opportunity.
Yeah. Yeah.
Yeah.
I can see how
And
it's
I
quite
yeah,
fulfilling actually, isn't it?
it is. And you just feel good about it. And it just makes you, I think the problem is with dental nurses, years ago we were just seen to be sitting there with the little Hoover and that's all we ever did and just sort of did what the dentist told us to do. But actually, dental nurses have moved on so much and our
Mm.
career pathways and as you know, Fiona started as a dental nurse and now she's got a PhD. It just
Yeah.
shows that anything is possible and as nurses, we a lot of us, there are some that are quite happy to sit in chairside and that's fine too. But if you want to take a different approach, then why not?
Yeah.
And move on.
And dentistry is a broad enough profession for you to be able to
Absolutely.
do that, really, isn't
Yeah,
it?
definitely. Yeah, yeah. And I think that's really good. And a lot of the dentists that are coming through, especially the newer ones, that they're very keen to sort of move the dental nurses forward and utilize them in a much useful manner rather than just having them a chairside. And I think that's the problem that we were just seen as just the chairside assistant, but actually there's so much more to us as a profession and what we could offer is incredible and we could make so much difference
Mm.
and change practices and get out there and give oral health advice and practical advice. There's no stopping us really if people if people are willing to give us a try and look at what we can do.
Indeed, indeed. Yeah, but I think the anxiety management as well is just incredibly valuable, isn't it?
It is, and I think we've seen so much. improvement with so many patients that really wouldn't have been able to access dental care for whatever reason. And a lot of my patients have additional needs, so autism, learning disabilities. So familiarity is often just all they need. And sometimes just that bringing them in every couple of weeks just to say hello, sit in the chair and walk out again is adequate. And once they've got that it's okay and it's safe, they're very happy to come in. And then they too, we're closing that inequality gap as well, because they're getting regular access to dental care, where again, as we know, the vulnerable are the ones that have that huge health inequalities, where this way we're keeping up and stopping them with the inequalities. We're kind of closing that gap considerably.
It's transformative, isn't it?
It is, yeah. And I've even patients that have not been able to have blood pressures done and things like that with special needs, like learning disabilities. I've been working with other services with the doctor or with an learning disability nurse and that, and I've managed to get blood pressures done for them, which nobody's ever managed to do. So again, we're closing that gap. We're making sure that their health is as important as everyone else's, and they have access to the care that may not have been able to be possible previously.
Oh, that's brilliant. Yeah. Well, thank you so much for telling us about it, Lisa. It's really interesting. And then keep us informed as to how things go.
I shall. Thank you. No, thank you for listening. Thank you.
Thanks for your time.